professor at the University of Ottawa. Welcome back. It's been a while.
It has been a while. You've been distant, socially distancing.
What did you think of those comments?
Well, I'm glad that it's no longer tied to a calendar date. It's always rubbed me the wrong way when we take restrictions off the table based on some arbitrary date. Sounds like they're tying it to something observable in the population, and that's the way to do it. But I hope that the metrics they choose are rational ones.
So when we're talking about metrics, are we at a point, first of all, even if he's not saying for sure this is going to happen, are we at a point in your view in Ontario where we should be discussing this, lifting the mask mandate? Are we there?
Well, we're always there to discuss it. It's not we're never wrong
Right.
to discuss something. The question is, why this restriction and not other ones? So, to my mind, the masking is the last thing that should go. The first thing that should go is capacity limits, probably physical distancing. The vaccine passport's gone already. But the mask wearing, if everything else fails, you can always wear a mask. That's the last line of defense. It's a high impact, low cost tool. And the only reason to do away with it, frankly, is the symbolism associated with it. Every time you see a newspaper article or a blog post or something involving COVID, there's an image of someone wearing a mask next to it. So I think it's psychologically triggering. That's the only reason people want to go for it. But I think we should be very skeptical and hesitant to remove the masking until we're sure it's safe to do so.
Right. So what would you be looking for that would indicate to you it is safe to do so?
There are a set of indicators. I divide them into three categories: epidemiological, population, and health systems. So the population ones are how many people have been vaccinated. The epidemiological ones are how many cases are there, and the health systems ones are how much space do we have in the hospitals. Now, the problem with the epidemiological ones is that we don't do enough testing to be able to know exactly. But if we did, the CDC has said that if you have fewer than 50 cases per 100,000 people in your community, or less than a test positivity rate of 8%, it's probably okay to do away with your indoor masking requirement. We are well above 50 cases per 100,000. Remember when the mask mandates were enacted, we had about 150 cases per day in Ontario. We have over 2,000 per day now. So we're way away from that. So we look at those indicators, and when they're below certain thresholds and continuing to trend a certain direction, that's when I feel more confident.
Given what you're laying out right now, if we were to proceed with lifting the mask mandate at the end of March or after the end of March, what impact do you believe that would have?
Well, assuming that the indicators are below the thresholds I mentioned, then it may look good. But if they're not below those thresholds, what we're going to see is increased transmission, especially since we have this BA2 subvariant nipping at our heels here that's creating spikes in other countries. So it seems likely that we're going to see increased transmission, increased cases. Will that result in increased hospitalization? I don't know. I like to think no, because we have such good vaccination rates and reinfection rates and so forth. But I don't want to roll those dice, because the other unknown here is kids under 5 haven't been vaccinated. So they are a profoundly susceptible population without the benefit of vaccine preventing serious disease. So anything we can do to prevent the disease penetrating into that pediatric population, I'm in favor of.
The Omicron subvariant you just mentioned continues to spread in Ontario, and in fact, Dr. Kieran Moore says it's on track to becoming the dominant strain. How significant is that subvariant on our COVID situation?
Well, it can transmit maybe 30% more readily than the Omicron Prime. I love saying Omicron Prime, sounds like a transformer. But it may not be as serious. So South African data suggests that the risk of hospitalization is no different. However, South African population is younger than ours, and they are just less of a risk of hospitalization in general. The risk is, because it's more transmissible, those people who have not been vaccinated are now at more risk of getting it, even though they're already at high risk right now. So we'll see an increase in cases without exception. Again, the unknown is, will that result in more hospitalization? I think it probably will.
Chatting right now with Raywat Deonandan, epidemiologist, who joins us on the show from time to time. I was talking about my best friend in Denmark, and then I was looking at Denmark today, and I was looking at their situation. They lifted most of the pandemic restrictions last month. They say they don't consider it a socially critical disease. Is there anything we can learn from their experience doing that?
Yeah, we can learn we're not Denmark. And we have a different healthcare system. Ours is provincial, theirs is federal. They have a much better trust in their fellow citizen to act responsibly than we do. They have much higher healthcare capacity. Amongst OECD nations, Canada ranks in the bottom 10 in terms of hospital beds per capita. We rank in the bottom 2 in terms of acute care beds. We don't have a lot of room to wiggle here. And we have a much more inequitable society. So when you remove these restrictions, what you're essentially doing is downloading the responsibility for pandemic management onto the individual. And that's going to happen eventually. It has to happen eventually. The problem there is not every individual is able to do it the same amount. So socioeconomic differences, education differences, and so forth, and that is less of a case in Denmark. So I'm skeptical that that approach is ours unless we do it more carefully in a more staged way. We have to do it eventually, just in a more slow and methodical way.
The one response I'm seeing on the text board from people is let society go about its own business and let people make their own decisions. I'll read you this one text message. This person says, I'm going to wear a mask selectively when I see fit. The government should remove all restrictions and let people make their own decisions. Thanks. Now, if we're in a situation like that where they drop the mask mandate, but some people are wearing the mask and some people aren't, how effective is it? Let's say if you and I are inside, I'm wearing a mask and you're not. How effective is that situation?
Depends on what outcome we care about and what kind of mask we're talking about here. If we're talking about overall population reduction in transmission, it's not going to be as effective. If we're talking about the ability of an individual to protect themselves, an N95 mask actually is a pretty good bulwark. So if everybody else is making bad decisions and you decide you need protection, wear an N95 mask and limit your time in a certain setting, you got pretty good protection there. So when I talk about masks,
the KN95 mask?
The KN95 is almost as good as an N95 because the N95 is more for clinical use. The KN95 is for everybody else. So, but when I talk about mask mandates, I'm really talking mostly about schools here, because schools, you have a lot of unvaccinated kids present. For them, I think it's important that as many people as possible do what we can to reduce the spread until everybody has access to vaccination. Other indoor settings, yeah, you can choose not to go. You can choose to wear a mask. But we have to do the work to destigmatize it for those who choose to wear masks. You can't have people staring at them and mocking them for choosing to self-protect. You don't know what the situation is. That's my biggest concern, frankly, is can we normalize the mask wearing so then when it does become an individual choice, individuals are free socially to make that choice.
At what point does COVID-19 become an endemic? The magic question.
Get that question every day, it seems.
I'm sure you do.
Well, first of all, what does endemic mean? Endemic means it's here all the time without going in waves. That can be at very high levels or very low levels. It could be here right now at a very high level. That's not good. What we want to do is deploy our mitigation tools, drive the cases down, use vaccination to keep them that way, and then let go of the brake and see if we can coast on a low level of endemicity. And endemicity happens locally, not globally. It'll probably happen in this country, I think, sometime this year, assuming no new variants show up, which is not a good assumption to make. But yeah, something resembling endemicity will probably happen this year, I think, but what do I know?
Well, we'll leave it there, Raywat Deonandan. Good to have you on the show.
My pleasure. Thank you.
Thank you so much, Raywat Deonandan.
Oh, I know.